1 out of 4 children has a problem. Learn what that problem is and how to prevent it coming up on A Healthier You. Hello, I'm Kelly Schermerhorn at Catawba County Public Health, and I'm here with Melinda Baumgartner, our dental hygienist at the Catawba County Public Health dental practice. Now, Melinda, can you tell me what is a problem that 1 out of 4 children faces?
Sure. 1 out of 4 kids, ages 4 through 11, have untreated dental disease, dental caries or cavities, you may have heard it called. So,
Okay.
And those are left untreated.
Well, that sounds pretty serious. Dental disease, I'm sure, is just as chronic as many other diseases. So, what would be an important step to preventing dental cavities that can lead to dental disease?
Right. Well, prevention is the key. So, the biggest thing that's recommended now, the American Dental Association recommends that by age 1, that a child has their first dental visit. That a dental home is created, and that child comes in and has a dental exam.
Okay. Well, I think that's good information. Maybe not everybody knows that their children should see the dentist by the time that they turn 1. And certainly it makes sense because kids will get an opportunity to become comfortable with the dentist at an early age. So let's talk a little bit more. What happens at that first visit?
Right. Well, it's really, really easy. Usually for the 1 and 2 year olds, we just ask that the parent or caregiver bring in their child. They get to come back into the treatment area with their child. They usually hold their child, and we just sort of have them lean back onto a little soft pillow, and Dr. Maddie actually examines their teeth, looks with the mirror, uses the little overhead light, and we just do a pretty quick visual exam. If we notice any problems of cavities, we'll let the parent know. If we notice any areas where maybe they need to work a little harder with their cleaning, brushing, or flossing even, we'll show parents that as well.
Okay, great. Well, that sounds like a thorough but easy exam, as you mentioned. Besides doing the visual oral exam, do you share any nutritional tips or anything along the way?
Right. Probably the biggest part of that visit is that we do a lot of nutritional counseling, talk a lot about diet, what the child's drinking, that type thing.
Okay, so I would assume that you're probably giving advice such as staying away from sugary items, or I think you've mentioned in the past sticky or gummy stuff.
Right. Yeah, sticky sweets, that's a big, big problem. Of course, candy and gum are the 2 things that are really, really bad for children's teeth, but also like gummies, gummy fruit snacks, things like that, and of course sugary drinks. Anything other than water, white milk, diluted juice is good, white milk is good, water is good, but anything other than that maybe would have too much sugar to give that to your child on a daily basis.
Okay, great. Well, so we've covered the nutrition part of it, but what about when it comes to the actual tooth care? I mean, what do you recommend as far as toothpaste and how many times a day to brush?
Right. Actually, as you know, even before your baby has teeth, after they have their bottle or have their meal of the day, you can use just a washcloth and just wipe their gums just to keep those free of any sugars. But as soon as that first tooth appears, you really want to make sure to clean it twice a day, just like you would for an older child. But for babies ages 0 to 2, you would not want to use regular toothpaste. You would want to use what's considered an infant or training toothpaste that is safe to swallow. After age 2, you can use any fluoridated children's toothpaste that's approved by the American Dental Association, but you only want to use what's considered a smear, which is about the size of a grain of rice. So, and you also want to teach your child to rinse with water and spit that toothpaste out each time. But it's real important to clean your child's teeth every morning after breakfast and then right before bedtime.
Okay, great. Well, good information, especially in regards to the toothpaste. Knowing not to use a toothpaste with fluoride before the age of 2, or even really before a child knows how to spit. You covered that.
Right.
But certainly after the child can spit, maybe after they're 2 years old, you can use a toothpaste with fluoride. I'm sure that a lot of parents now are maybe curious about finding a dentist for their children if they don't already have one. So can you talk a little bit about what kind of children come here to your dental practice?
Right. Well, here at Catawba County Public Health, we do see children ages 1 through 21. And we do those first easy knee-to-knee visits for the 1 and 2 year olds, but starting at age 3, we, put the child in the dental chair and do just a complete exam like we would for an older child. So we are seeing patients, like I said, ages 1 through 21 that are covered under Medicaid or Health Choice.
Okay, great. Well, thank you for all the wonderful information today.
You're welcome.
So to recap, especially as this information is helpful during National Dental Health Month, we shared that children should see the dentist by the time they're 1 and continue seeing the dentist at least twice a year after that point, and that on a regular basis they should brush twice a day. So if you are looking for a dentist, Catawba County Public Health Dental Practice is enrolling children ages 1 to 21 with Medicaid or Health Choice insurance. And to find out more information or to make an appointment, you can call 828-695-5778.